Part 1. 50 multiple choice questions on antibiotics pharmacology. Number 1. Which of the following antibiotics inhibits cell wall synthesis? A. Ciprofloxacin, B. Tetracycline, C. Penicillin, D. Rifampin. The answer is C. Penicillin. Number 2. Which class of antibiotics targets bacterial ribosomes? A. Beta-Lactams, B. Fluoroquinolones, C. Aminoglycosides, D. Sulfonamides. The answer is C. Aminoglycosides. Number 3. Which of the following is a bacteriostatic antibiotic? A. Vancomycin, B. Tetracycline, C. Penicillin, D. Ceftriaxone. The answer is B. Tetracycline. Number 4. Which antibiotic class inhibits DNA guides? A. Fluoroquinolones, B. Macrolides, C. Beta-Lactams, D. Tetracyclines. The answer is A. Fluoroquinolones. Number 5. Which of the following is not a beta-lactam antibiotic? A. Ceftriaxone, B. Amoxicillin, C. Azithromycin, D. Meropenem. The answer is C. Azithromycin. Number 6. Which of the following beta-lactam antibiotics is resistant to beta-lactamase? A. Amoxicillin, B. Penicillin G, C. Oxacillin, D. Piperacillin. The answer is C. Oxacillin. Number 7. Which cephalosporin is commonly used for surgical prophylaxis? A. Cefazolin, B. Cefepime, C. Ceftazidime, D. Ceftriaxone. The answer is A. Cefazolin. Number 8. Which of the following cephalosporins has the best activity against Pseudomonas aeruginosa? A. Ceftriaxone, B. Cefepime, C. Cefuroxime, D. Cephalexin. The answer is B. Cefepime. Number 9. Which of the following is a major side effect of aminoglycosides? A. Hepatotoxicity, B. Nephrotoxicity, C. Cardiotoxicity, D. Pancreatitis. The answer is B. Nephrotoxicity. Number 10. Which of the following aminoglycosides is most ototoxic? A. Gentamicin, B. Tobramycin, C. Amikacin, D. Streptomycin. The answer is D. Streptomycin. Number 11. Tetracyclines are contraindicated in A. Elderly patients, B. Pregnant women, C. Patients with hypertension, D. Patients with asthma. The answer is B. Pregnant women. Number 12. Which tetracycline is used in SIADH? A. Doxycycline, B. minocycline, C. tigecycline, D. demiclocycline. The answer is D. demiclocycline. Number 13. Which macrolide has the longest half-life? A. azithromycin, B. erythromycin, C. clarithromycin, D. telithromycin. The answer is A. azithromycin. Number 14. Clindamycin is most commonly associated with A. nephrotoxicity, B. C. difficile infection, C. ototoxicity, D. hypoglycemia. The answer is B. C. difficile infection. Number 15. Fluoroquinolones inhibit A. RNA polymerase, B. topoisomerase 2 and 4, C. 50 sedimentation ribosome, D. cell wall synthesis. The answer is B. Topoisomerase 2 and 4. Number 16. A major side effects of fluoroquinolones is A. Tendon rupture, B. Hepatotoxicity, C. Peripheral neuropathy, D. Anaphylaxis. The answer is A. Tendon rupture. Number 17. Linezolid is mainly used for A. Gram-negative infections, B. MRSA and RA infections, C. Pseudomonas infections, D. Anaerobic infections. The answer is B. MRSA and RA infections. Number 18. What is the mechanism of action of metronidazole? A. Inhibits bacterial cell wall synthesis. B. Disrupts DNA by forming free radicals. C. Inhibits 50 sedimentation ribosome. D. Blocks folate synthesis. The answer is B. Disrupts DNA by forming free radicals. Number 19. The most common mechanism of penicillin resistance is A. Altered ribosomal target, B. Beta-lactamase production, C. DNA virus mutation, D. Purine loss. The answer is B. Beta-lactamase production. Number 20. Methicillin-resistant Staphylococcus aureus or MRSA resistance is due to A. Alteration of penicillin binding proteins, B. Production of beta-lactamase, C. Efflux pumps, D. Ribosomal modifications. The answer is A. Alteration of penicillin binding proteins. Number 21. Which of the following antibiotics is a beta-lactam? A. Vancomycin, B. Ciprofloxacin, C. Amoxicillin, D. Doxycycline. The answer is C. Amoxicillin. Number 22. Beta-lactam antibiotics inhibit bacterial growth by A. Inhibiting protein synthesis, B. Disrupting DNA replication, C. Inhibiting peptidoglycan synthesis, D. Blocking folic acid synthesis. The answer is C. Inhibiting peptidoglycan synthesis. Number 23. Which of the following antibiotics inhibits bacterial protein synthesis by binding to the 13 sedimentation ribosomal subunits? A. Erythromycin, B. Tetracycline, C. Clindamycin, D. Chloramphenicol. The answer is B. Tetracycline. Number 24. Which antibiotic class is bacteriostatic rather than bactericidal? A. Aminoglycosides, B. Fluoroquinolones, C. Tetracyclines, D. Beta-lactams. The answer is C. Tetracyclines. Number 25. Fluoroquinolones act by inhibiting A. DNA virus and topoisomerase 4, B. Peptidoglycan synthesis, C. 50 sedimentation ribosomal subunit, D. Folate metabolism. The answer is A. DNA virus and topoisomerase 4. Number 26. Which beta-lactam has the broadest spectrum of activity? A. Penicillin G, B. Ceftriaxone, C. Meropenem, D. Amoxicillin. The answer is C. Meropenem. Number 27. The most common mechanism of resistance to penicillins is A. Altered ribosome binding sites, B. Beta-lactamase production, C. DNA virus mutation, D. Reduced permeability. The answer is B. Beta-lactamase production. Number 28. Clavulanic acid is used in combination with amoxicillin because A. It improves oral absorption, B. It inhibits beta-lactamases, C. It enhances penetration into tissues, D. It increases bactericidal activity. The answer is B. It inhibits beta-lactamases. Number 29. Which of the following antibiotics can cause ototoxicity and nephrotoxicity? A. Tetracycline, B. Ciprofloxacin, C. Gentamicin, D. Erythromycin. The answer is C. Gentamicin. Number 30. Which antibiotic is associated with red man syndrome? A. Vancomycin, B. Rifampin, C. Daptomycin, D. Linezolid. The answer is A. Vancomycin. Number 31. Which antibiotic class can cause tendon rupture? A. Tetracyclines, B. Fluoroquinolones, C. Beta-Lactams, D. Macrolides. The answer is B. Fluoroquinolones. Number 32. Which antibiotic is contraindicated in pregnancy due to fetal bone growth inhibition? A. Amoxicillin, B. Tetracycline, C. Azithromycin, D. Ceftriaxone. The answer is B. Tetracycline. Number 33. Which antibiotic is the drug of choice for MRSA infections? A. Amoxicillin, B. Ceftriaxone, C. Vancomycin, D. Piperacillin and Azobactam. The answer is C. Vancomycin. Number 34. Which antibiotic is recommended for Clostridioides difficile infection? A. Metronidazole, B. Azithromycin, C. Amoxicillin, D. Vancomycin oral. The answer is D. Vancomycin oral. Number 35. A patient with anaphylaxis to penicillin is most likely to have cross-reactivity with A. Azithromycin, B. Cefazolin, C. Clindamycin, D. Linezolid. The answer is B. Cefazolin. Number 36. Which antibiotic class covers atypical bacteria like Mycoplasma and Chlamydia? A. Aminoglycosides, B. Beta-Lactams, C. Macrolides, D. Glycopeptides. The answer is C. Macrolides. Number 37. Which antibiotic is first-line treatment for Helicobacter pylori infection? A. Metronidazole plus amoxicillin plus clarithromycin, B. Ciprofloxacin plus doxycycline, C. Vancomycin plus linezolid, D. Gentamicin plus rifampin. The answer is A. Metronidazole plus amoxicillin plus clarithromycin. Number 38. Which of the following is a beta-lactam antibiotic? A. Tetracycline, B. Penicillin, C. Chloramphenicol, D. Vancomycin. The answer is B. Penicillin. Number 39. What is the mechanism of action of beta-lactam antibiotics? A. Inhibiting protein synthesis, B. Inhibiting cell wall synthesis, C. Disrupting DNA synthesis, D. Inhibiting folic acid synthesis. The answer is B. Inhibiting cell wall synthesis. Number 40. Which class of antibiotics inhibits bacterial DNA guidance? A. Macrolides, B. Fluoroquinolones, C. Aminoglycosides, D. Tetracyclines. The answer is B. Fluoroquinolones. Number 41. Which antibiotic is known to cause gray baby syndrome? A. Chloramphenicol, B. Gentamicin, C. Amikacin, D. Erythromycin. The answer is A. Chloramphenicol. Number 42. Aminoglycosides exhibit which type of killing? A. Time dependent, B. Concentration dependent, C. Both time and concentration dependent, D. None of the above. The answer is B. Concentration dependent. Number 43. Which of the following is resistant to beta-lactamase? A. Penicillin G, B. Ampicillin, C. Methicillin, D. Amoxicillin. The answer is C. Methicillin. Number 44. Which penicillin is effective against Pseudomonas aeruginosa? A. Penicillin G. B. Piperacillin. C. Ampicillin. D. Byzantine penicillin. The answer is B. Piperacillin. Number 45. Clavulanic acid is used in combination with amoxicillin because A. It enhances drug absorption. B. It extends the half-life. C. It inhibits beta-lactamase enzymes. D. It increases renal clearance. The answer is C. It inhibits beta-lactamase enzymes. Number 46. Ciprofloxacin belongs to which generation of fluoroquinolones? A. First. B. Second. C. Third. D. Fourth. The answer is B. Second. Number 47. What is a major adverse effect of fluoroquinolones? A. Nephrotoxicity. B. Tendon rupture. C. Hepatotoxicity. D. Redman syndrome. The answer is B. Tendon rupture. Number 48. Which fluoroquinolone is most effective against anaerobes? A. Ciprofloxacin. B. Levofloxacin. C. Moxifloxacin. D. Norfloxacin. The answer is C. Moxifloxacin. Number 49. Which macrolide has the longest half-life? A. Azithromycin. B. Erythromycin. C. Clarithromycin. D. Roxithromycin. The answer is A. Azithromycin. Number 50. Tetracyclines should not be given to children under 8 years because they A. Cause neurotoxicity. B. Deposit in teeth and bones. C. Cause hepatotoxicity. D. Affect red blood cell production. The answer is B. Deposit in teeth and bones.